As I turn on my mic on 288, and I recognize Senator Ruth Ward. Whenever you're ready, Senator. Make sure my phone's off.
Morning, Mr. Chair and the members of the committee. For the record, I am Senator Ruth Ward. I represent 20 towns in District 8 from Dunbarton, just below Concord, to Claremont and Charlestown by the river, Connecticut River, that is. So, on behalf of 13 of my colleagues who joined me from both sides of the aisle to sponsor this bill, I'm here to introduce Senate Bill 288 after hearing directly from one of my constituents about the challenges with access to inpatient care. Last year, a constituent was seeking care for her mother who fell and broke a bone in her foot. The hospital she went to had no inpatient bed capacity. All patients' beds were full, and her mother spent 3 nights in the hallway of an emergency department. Fortunately, my constituent was able to finally get into an inpatient bed and cared for before going to a rehab facility. We know that one of the biggest challenges with access to inpatient bed capacity is that many beds are being taken up by non-acute patients, patients waiting to go to a step-down facility for less care, not acute care, but long-term care. For example, in the barriers to discharge report, on a single day in the summer week, the Foundation for Healthy Communities identified 46 patients in hospital across the state waiting for a long-term care bed, accumulating 105 unnecessary extra days in a hospital. And if you know what an inpatient bed costs, that's a lot of money that is not being compensated for. Staffing continues to be a major challenge for long-term care facilities, but something must be done to increase access to long-term care. SB 288 would establish an advisory council on long-term care to engage stakeholders, gather data, and make recommendations to improve access to long-term care within the system of care for healthy aging. I appreciate the effort of many stakeholders working to draft an amendment, which I think we're going to get shortly, to SB 288 to establish the Advisory Council on Long-Term Care within the Commission on Aging, instead of having it under the Department of Health and Human Services. I ask for the committee's support of this important bill and hope to have an amendment ready for the committee consideration for executive session. And like I said, it's being worked on, the amendments. I could take questions, but I think I have people behind me who know an awful lot more about long-term care and the problems than I do.
Thank you, Senator. We appreciate you bringing the bill forward, and we'll let the other people testify and answer questions if we have any. So with that, Craig Labor. Did I pronounce that right? Labor.
Singing my testimony?
Well, the choir's up here.
When in France.
When in French. Okay, whatever. All right, you have the floor.
All right, thank you very much. Good morning. My name is Craig Labor, and I serve as the president of the nursing home affiliate for the New Hampshire Association of Counties, as well as the nursing home administrator at Grafton County Nursing Home. Shout out for Grafton County. Yeah. I am here today to testify in opposition to Senate Bill 288. The Association of Counties, and we just submitted a letter to the committee dated in February of 17th of 2025, kind of outlining our position on this proposed legislation, and I'm just going to highlight a few of those key points here for us from our perspective. The Association of Counties believes that this legislation would create a duplicative commission for work already being done by the County State Finance Commission. which was established under state statute RSA 28B in 2003. This County State Finance Commission was created to provide counties with a voice in the decision-making process on matters related to long-term services and supports due to our obligation under state statute to fund the non-federal share of Medicaid expense for the long-term services and supports program. So we believe that several of the stated duties of the Advisory Council overlap with those of the County State Finance Commission and the agenda items that we discuss on a frequent basis at our meetings. A few of examples of this overlap include the system of care legislation, the process for accessing the Medicaid long-term care benefit, barriers to hospital discharge, the CFI program, and the need for strengthening the direct care workforce. The Association of Counties would welcome and encourage supporters of this bill to attend our County State Finance Commission meetings, which are public and are open to the public. And our association would also recommend that supporters of this bill put their name forward to fill the vacant public member position on the County State Finance Commission, which the governor is currently looking to fill at this time. So in conclusion, the Association of Counties respectfully asks that this committee support our opinion that SB 288 creates a duplicative public commission and will compete with work already being done through the County State Finance Commission, and therefore vote this bill inexpedient to legislate.
Thank you for your testimony. Questions? Senator Prentice.
Thank you, Senator Avard, and good morning.
Good morning.
Thank you for taking my question, and welcome down from Grafton County. So your position is that this is duplicative?
Correct.
Okay, but you do have a seat, or the New Hampshire Association of Counties does have a seat on this proposed commission, and this is kind of like a whole train of thought, so
Go ahead.
without follow-up. So, and we've heard from Senator Ward, as well as, I've been acutely aware, and in the time that I've been here, I've been trying to work with, there've been multiple efforts to try to find one mechanism or different mechanisms to get patients that aren't really patients out of where they are to someplace else, which is a better setting for them. Is there any way, and we'll send it to merge these efforts? I understand you're saying it's duplicative, but there's a time for this, and so I'm a little worried. And where you have a seat, I don't see how you couldn't bring your efforts and combine them in here. Is that all?
Yeah.
It's like a stream of consciousness, but I feel like I hear what you're saying about duplicative, but I also think there's an opportunity. There's no exclusion, there's inclusion in this. So how do we make this work together?
I think we would have to probably hear the amendment that gets proposed. And then I think the association would probably have to talk amongst the executive committee and make a determination of where we see ourselves fitting in potentially on that.
Okay.
Again, I think just to reiterate the stated concern of the fact that these conversations are already taking place. We feel the Association of Counties should have a larger voice in the process, which because of our funding obligations. And so I think that, that's why we feel as though the role of the County State Finance Commission and the key players that are around that table are already kind of discussing these types of things. And so that's why we feel it's duplicative and not necessarily needed at this moment.
Oh. Senator Wong?
I'm good for now. Thank you.
Thank you very much.
Okay, thank you.
Let's see. Therese. And you didn't mark in favor or against, so I think you're ambivalent. Okay. And hit the mic.
Teresa Rosenberger, representing the New Hampshire Brain Injury Association, and I work for Bernstein Shore. We are neutral on the bill. We just like to be included. I understand there is an amendment coming. The Brain Injury Association supports, and has been for over a half a century, supports all ages for long-term care with brain injuries. And as you know, particularly acquired brain injuries. And brain injuries can come from, like myself, falling off my bicycle and hitting my head, or you can have a stroke, an aneurysm, etc. It hits all ages. This bill seems to be focused on aging, but we spend an awful lot of time working with families with children that it's long-term care. A child who falls off their bicycle and has an acquired brain injury, clearly it's going to, if depending on how bad it is, need long-term care. So we had asked that there be an amendment to this bill, adding one member representing the New Hampshire Brain Injury Association. I haven't seen the amendment. I know it's going under the Commission on Aging. We would hope we could get appointed to be on that aging commission, even though that's about aging, long-term care really does impact all ages. As you know, Cedar Crest and Keene supports kids with, it's a nursing facility, kids with long-term care, particularly brain injuries. So we'd just like a seat at the table.
All right, so this list can keep growing, couldn't it?
Well, hopefully not the list of how you get a brain injury, but maybe. But yes, the list could keep growing. We just feel like our voice is quite important as to how we deal with long-term care issues for all our citizens, older and younger.
Okay,
you.
questions? Seeing none?
Thank you.
Well done. Heidi?
Good morning, Mr. Chairman and members of the committee. For the record, my name is Heidi Kroll. I work at J. Grimbalis Strategic Solutions. I'm here today on behalf of our client, Life Coping. Life Coping does home and community-based case management services. They're based in Nashua, but have a statewide footprint. And they work with clients who are eligible for the Choices for Independence program, as well as developmental disabilities, and I believe also some folks who are in the acquired brain disorders waiver as well. And so we are in support of the bill. Like the prior speaker, we are very interested in having a voting member seat on this commission or council if it moves forward. The case managers play a critical role in really being an advocate for folks once they've cleared eligibility to be eligible for Medicaid. The case manager really is the person who works with the client to assess what their needs are, to figure out what services they need, how frequently they need those services, and to work with the patient and the family to set up those services, to make sure that those services are working well for the patient, and keeping close tabs on the patient if their needs change over time, adjusting the services accordingly so that they're getting the services that they need. So we think that we have play an important role and could be a valuable member to the council as well. So appreciate your time and happy to answer any questions.
Have you seen any of the wording on the amendments?
We have not,
Okay.
no.
Questions?
No, we'll see about the amendment. I have questions about the amendments that are
Yeah.
not for Heidi, but thank you.
Thank you, Heidi.
Okay, thank you.
Answers.
Are you here on this bill too?
Lisa?
Yes.
No, I'm on the last classes, still dealing with Medicaid reimbursement for nursing homes.
Okay. All right.
257, I think it is.
All right.
257,
Gonna let you.
flat down,
It's good to see you again.
left.
All right. Let's see, Rebecca. No. Yes, you can. I'm teasing. Ben?
Thanks, Senator. Good morning. For the record, my name is Ben Bradley. I'm Vice President of State Government Relations for the New Hampshire Hospital Association. We represent all the state's 26 acute care hospitals and all specialty hospitals in the state. We are supportive of SB 288. We feel this is part of our multi-pronged approach to lower complex barriers to patient transfers out of a hospital inpatient bed and into a more appropriate level of care. I want to thank Senator Ward, other stakeholders who have participated in these conversations, you, Senator Avard, for the work you've done on guardianship, the work Senator Rochford has done on long-term care, Medicaid eligibility, and of course, like I said, Senator Ward on this bill. As been mentioned, the Hospital Association and Foundation for Healthy Communities published a really compelling report on the barriers to hospital discharge, which I've circulated to the committee in the past. Notably on this topic, in that report on one given day in June, there were, as Senator Ward identified, several patients accumulating many unnecessary days in the hospital. We found that it's a median of about 72 unnecessary days for patients waiting to get placed in a long-term care facility. That's over 2 months for each of those patients that they remained in a hospital bed until they could be discharged. The cost of these barriers is multifactorial. Really, we feel that it's first and foremost the toll the barriers cause on our patients, families, and the caregivers, the people who work at the hospital, who see these patients every day, try to celebrate birthdays or other occasions that they may be going through. Secondly, the challenges these barriers pose to other patients, such as those waiting in an emergency department for an inpatient bed to become available. You know, that's what Senator Ward noted from her constituent that had the challenge of moving into an inpatient bed, but there was no access. And finally, the financial stability of our healthcare system. From our report, we estimate that the accumulated cost of the long-term care patients or the patients awaiting a placement in long-term care to be over $10 million in that report. That's because insurance does not pay for the non-acute care services provided in an inpatient hospital setting. This bill establishes an advisory council to gather data, review policies, and make recommendations to help support access to long-term care through the efforts of healthy aging. As I noted, we've been working with many stakeholders on these efforts in the multifactorial and multi-pronged approach. And we hope to see a refined amendment to this bill that we can support and get some work done on this front. So thanks for,
Are you working with Senator Ward on that amendment?
yes.
Okay. Senator Prentice?
Senator Avard. Good morning, Ben.
Good morning.
And we're, I look forward to being able to see this amendment because it may answer some of the questions as well as address some, just, we started to hear some concerns.
That's what I'm
but-
here for. That's what I'm here for.
Yeah, so but we heard from the counties this morning already in opposition to this because concerned about, what I hear is a duplication, but they're in the current, language of this to be on this. So I'm just wondering what your opinion is about, I mean, I have my opinion about when you bring groups in that are already doing work into these multi-stakeholder, multifactorial groups, because I think that's their job is to bring that perspective to the table.
Yeah.
Do you see that there's any duplication, or this would just make sure that piece, the role of the counties is so important, their nursing homes, in these conversations? So I'm looking for what your opinion is, if I may ask you, on how this could dovetail in nicely and not be
Certainly.
duplicative.
Yeah, I think the work of the state county financing authority is very important. The counties have always been committed to that and look out for the interests of patients and of course the financial interests of our long-term care system. I think that needs to be an important element of the establishment of this advisory council while we bring in the Department of Health and Human Services and other stakeholders through the state Commission on Aging, and Rebecca Sky is here. She can fill in how that could be how that could be structured in a way to engage many more stakeholders than just what the State County Financing Authority has.
Okay, so thank you very much.
No further questions. Thank you very much,
Thanks,
Ben.
Senator.
Rebecca, are you ready now? All right.
Thank you for your time today. My name is Rebecca Sky. I'm the Executive Director for the New Hampshire State Commission on Aging. We are in support of this bill. This is a very complicated issue that we all know has been around for a long time, and that it's gotten worse in recent years. We do feel that the commission is well positioned to tackle this issue. We have named systems of care for healthy aging as a priority, needing attention by our state. In our annual reports for the past several years, and we do feel like we have broad representation on the commission. It's a place where special interests don't necessarily have an outsized voice. I don't think that this is a competition with the with the County State Finance Commission. Absolutely want to work in partnership with them. We are working in partnership on the amendment with the New Hampshire Hospital Association, with Senator Ward, with the Department of Health and Human Services that houses the County State Finance Commission. Our commission meetings are public meetings. They are there's access posted on our website, the dates, the times, the places, the Zoom links if you want to join by remote access. We tried accessibility is a main focus of the commission. We do have a lot of smart people around the table. We heard from several people today about their interest in participating in developing solutions. We do need to have all those voices. It's as Ben had said, it's a multifactorial problem that requires multifactorial solutions. I just at this point would love to answer any questions that you have about how we might approach this issue on the commission.
Thank you for your testimony. Questions? Senator Long.
Thank you, Mr. Chairman. Thank you for your testimony. Now, are you familiar with the County State Finance Commission?
Yes.
And as far as that work, do you see some duplications with this?
We do have, so David Ross, who serves on that commission, also serves on the Commission on Aging. So we already have that representation at the table. We do try to work in partnership with the people the counties here in New Hampshire, recognizing the outsized burden. The commission did an informal study of how much of county budgets is spent on long-term services and supports, looking at publicly available information on websites. And it was a couple years back, but it was about 55% of county budgets. We've realized that our state really needs to diversify funding for long-term services and supports, especially when you consider the growth in the 85-plus population of our state over the long term. So that's just some of the beginning research that we have done into this issue, and we've been proposing working on a multi-sector plan for aging, an Age Well NH plan that's a 10-year vision for our state, because some of these issues, they can't be solved tomorrow. We need a plan that takes us step by step to get us to where we want to be over time. That's longer than our political cycles. In New Hampshire, we have 2-year political cycles. We can't fix this in 2 years. And I just want to add, too, we have a lot of really smart people around the table. Nick Tumpus, previous commissioner of Department of Health and Human Services, recently joined the commission. He's ready to dig into this issue, as well as many of the other very smart people around the commission table. And we would bring in, it wouldn't be just commission members who participated in this. This would be a council that we would oversee, but it would be, we would bring in a broader group of stakeholders.
So you're of the opinion that this would be beneficial even with the County State Finance Commission?
I think we would have no problem working in partnership. Even in the original bill, I believe it calls for DHHS to have a staff member who is co-chairing this work, and I would think that they would also serve as a bridge between the two.
That's great. Thank you.
Seeing no further questions. Thank you.
Can I add one more thing?
No.
I did forget. This was a key point that I meant to bring forward. So the commission is very thinly staffed, and this is a problem that really deserves concerted attention. And I know that this is the wrong year to be bringing forward anything that a dollar something that might cost money, but without it being resourced with a staff person to address it, it would be very hard either for the County State Finance Commission or the Commission on Aging to address this issue. That's my final.
Thank you very much. Rebecca.
Okay.
And now the chairman has arrived.
Thank you very much. Courtney Tanner.
Morning. Good morning. For the record, Courtney Tanner. I serve as the Senior Director of Government Relations at Dartmouth Health. And we are very much in support of this bill. Unless you're having a baby, nobody really wants to be in the hospital. And in a utopia, many patients will come to the hospital, get access to their acute care needs, and then they'll be discharged to an appropriate setting quickly, whether that's back home with in-home supports and services, to a skilled nursing facility, or maybe a long-term care facility. But every day at Dartmouth Hitchcock Medical Center, specifically our flagship entity, we are not experiencing that. We have about 20% of our beds right now, of our 400 beds at the medical center, about 20% of those patients are ready for discharge and are stuck. We have patients that are there right now. The latest count I got this morning was 467 days past clinical need, 508. There's one patient there right now that's been there for 692 days past clinical need. And it's a complex problem. Senator Avard, thank you so much for your work on Senate Bill 127. That guardianship piece is going to be an important piece to the puzzle. It's a 1,000-piece puzzle, though, and we're working on each piece at a time. Senator Rochford, thank you for Senate Bill 131. That's going to be another important piece to the puzzle. That presumptive eligibility fund that you put forward is going to allow us to better partner with our long-term care facilities to receive these patients and not have to be in financial risk. So we're very supportive of all the pieces of the puzzle. And this Senate Bill 288 is another piece of the puzzle that we see is really important to move forward. We've been working really closely with the Department of Health and Human Services and the Commission on Aging to craft an amendment that's going to work. I'm sorry that it wasn't ready for today, but I think you'll see that all the right partners are there. I know there's some concern, some hesitancy from the counties. I appreciate that, but we don't have the puzzle together yet. And I think that this work that will happen after Senate Bill 288 is going to help to get that puzzle back together. I'm happy to take questions. As you know, Dartmouth Hitchcock Medical Center specifically is the only quaternary care center in the state, the only academic medical center in the state, the only level 1 trauma center in the state. And every month we're turning away approximately 250 patients because patients are stuck in our beds. So we need to make sure we can get patients out so that we can better serve our Granite Staters.
So you talk about an amendment. I mean, today is the drop dead date. in
There's
our
an amendment
committee,
already in the
so-
works. I think OLS has it.
Okay.
Yep.
We're mentioning that she's working on an amendment.
Okay.
Yeah.
Yeah, and
Today, or would it be a
For very soon.
floor amendment? Okay. All right.
I hope today, Senator.
All right. Hopefully within the next 2 hours.
Yeah.
Yeah.
Maybe one.
Yeah. All right. Thank you. Questions?
Just a question, yeah, you're aware I serve on the Alzheimer's
Yes.
subcommittee.
Yes.
Is there any type of information on how many people that are suffering from Alzheimer's that are trapped in these facilities?
You know, Senator, we are seeing more and more patients that are coming in that are navigating dementia, early onset Alzheimer's. Our patient population is aging, so we're seeing more of that, and we're also seeing more acute patients.
This takes in consideration for that advice?
It does,
Okay,
yeah.
that was my concern. Thank you.
Yeah.
Thanks, Senator.
Any other questions? All right, very good. Thank you very much. Anyone else that would like to speak on Senate Bill 288? Yes. Laura.
You okay?
Good morning, Chairman Rochefort and members of the Senate Health and Human Services Committee. I wasn't planning on speaking today. My name is Lara McIntyre. I work at Sheehan Finney Capital Group, and I am here today representing the Granite State Home Health and Hospice Association. The association is in support of this bill. We are supportive of the concept and anything to help the healthcare ecosystem, particularly for long-term care. We also have not seen the amendment, but look forward to seeing it. In the bill as introduced, we're currently named to the Long-Term Care Council, but as in the State Commission on Aging, if you look at RSA Section 19P:1, there is not a member of the Home Care Association specifically appointed to that commission. You'll see in Section J, it says 15 members of the public, including at least one member of each county, including representatives from the business community, healthcare, technology and innovation, municipal leaders, the Aging Network, advocacy organizations, caregivers, and direct service providers focused on the older adult population appointed by the governor. So we just wanted to let you know that we would like to be a part of the team to help address these barriers and to get people into the right care. So I'm happy to answer any questions if I can. If you
Are
have
there any questions? Thank you very much.
All right, thank you.
Anyone else that would like to speak on Senate Bill 288? Yes.
He was on the list.
Yeah, I don't think he had.
I don't know who that is.
That might be him.
Hit your light?
Oh, yeah. you can-
Good morning. My name is Adam Schreier, and I work with the Brain Injury Association of New Hampshire. I don't want to duplicate anything that Teresa already spoke to, but I did just want to reiterate that, individuals who are experiencing brain injuries often don't always fall into, one basket. And, as I think a lot of people are aware, individuals who have recently experienced a brain injury, who have maybe been successfully residing in their home, are now in a hospital and maybe aren't able to return to that environment, and they are unfortunately languishing in these inpatient settings for longer than necessary. And we just want to make sure that there is a voice for these individuals who've either they're individuals or families who've recently experienced brain injuries, so that way that this those issues are kind of considered on this council's work. So that was
Thank you very much. Are there any questions?
Do you like the bill?
I believe we're in support of the bill. Yes.
Any other questions? Thank you. Anyone else that would like to speak on Senate Bill 288? I'm going to close the hearing on Senate Bill 288.
I think the former speaker is going to want to. Who's the speaker, right?
Yes.
I think he's going to speak on this bill. Just
Okay. Yep. Yes, thank you.
Yeah. That's all we get when we leave here.
I know. All right.
Thank you very much.
Yes. Going to open the hearing on Senate Bill 257. And Tommy's here to introduce the bill.
Good morning, Chairman Rochefort and members of the Senate Health and Human Services Committee. For the record, my name is Tommy O'Neill, and I am the Minority Caucus Director. It is my pleasure to introduce SB 257 on behalf of Senator Tara Reardon, who represents District 15. This is a bill that would establish a committee to study the state guidelines for Medicaid eligibility determinations. I would also like to introduce Amendment 2025-0306S that makes 2 changes to the original bill. I have copies. Yeah. Give this to you now. The hope of the introduction of this bill is to further investigate the alternative pathways to determine Medicaid eligibility. The idea arose from Senator Reardon's work as a Merrimack County Commissioner and the possibility of an alternative and potentially more efficient method to qualify residents seeking admission to the Merrimack County Nursing Home. After meeting with Chris Santinella of DHHS, the duties of the proposed study committee have been expanded and now include the consideration of the purpose of the system of care for healthy aging outlined in RSA 151-E:22 and RSA 151-E:23 as shown in the amendment. The amendment also extends the reporting date for the committee out to November 1st, 2026. The original bill had a date of November 1st, 2025, which DHHS indicated was not sufficient to complete the work. I believe there are experts behind me from DHHS who can answer questions, as well as former speaker and state representative, now county commissioner, Steve Shirtless, who first brought this to Senator Reardon's attention. Thank you in advance for your consideration of SB 257.
Great, thank you very much. The Honorable Stephen Shirtliff.
Good morning, Mr. Chairman and members of the committee, and it's nice to know you can come home again. I just want to say my name is Steve Shortliff from Concord, and nothing I say is meant to be derogatory or demean the Health and Human Services. They do an outstanding job following the rules that they have to govern them in their operation. When I became county commissioner in November at the election, one of the first people I sat down and talked with was our administrator of the Merrimack County Nursing Home. And she told me at that time there were 24 people waiting to get admittance to our nursing home. That number now is up to 36 people waiting to get a bed. And I asked what the delay was, and she explained to me that to be certified by the state to be deemed worthy to receive Medicaid reimbursement to the county, it's a two-pronged test. First is, do you have a health need that requires you to have nursing home level health care? And that is adjudicated by a registered nurse at HHS. And within a week, they have the answer that, yeah, they do qualify for the health reason. And then the other one is a financial affidavit that they need to fill out about what their income status is and what they can afford to pay and what they can't afford to pay. And that seems to be the rub, Mr. Chairman. It's my understanding that the state has a 60-day requirement to get back to the petitioner. And usually on the 57th day, they'll get notification from HHS that their application is missing something. They sold a car 4 years ago. What happened to that money? 3 years ago, their sister passed away and left them $4,000. Where did that money go? And it's a lengthy process. Our administrator told us that we do have residents in Merrimack County that are actually paying for their own beds, their own monthly fee. But eventually, for some of those people, the money runs out. And the county will sit down with these individuals and help them fill out the paperwork and make sure it's correct. And they know what HHS is looking for. And those applications take approximately 70 days before they get approval from HHS that they can receive the funding through Medicaid. Now, I asked our administrator, what is the waiting period in Vermont and Maine? And they said there is none. They don't. See, we're the only New England state that follows SSI 209B. In fact, we're one of only 9 states in the country that follow that. The rest of the country is following SSA 1634, which is an easier form, especially for individuals to fill out. So I talked to my now Senator Reardon about this and to others, and I said, you know, there's an old saying that government is judged by how they treat people in the dawn of life, our children, and how they treat people in the twilight of our life. And I'm thinking for somebody who's obviously got a medical problem and needs to get into a nursing home, to wait 6 months or longer, to them, that can literally and figuratively be a lifetime. And so I would ask this committee to please vote favorably on this request and to form the study committee. If there's any questions, I'd be very glad to answer them if I can.
Thank you very much. I appreciate your testimony because you've been on this side of the microphone, and I take what you say, with a lot of insight, and so I appreciate you coming today.
Yeah. And I will add, this year I turned 78, and I'm in good health. I don't think I'll need assistance, but I never know. But I can have feelings for those of my age, though some I may have served in the service with, but well, I'll let it go at that.
Thank you. Senator Abard.
Thank you. Mr. Speaker, you said SSI 209B. What was the SSA what?
SSA 1634 is what the other 41 states are following.
Oh, it is? Yeah. Okay. You know what? Didn't read that part. Good job.
I know it was a test.
Thank you, sir.
Thank you.
Any other questions? Senator Long.
Thank you, Mr. Chair. Thank you, Mr. Speaker. The date of the report changing from 25 to 26, do you think it's that complicated? I mean, you had mentioned SSA 1634 is followed by 39 other states. Do you think it'd be that complicated to get a report?
I don't think so, but there may be knowledge that I'm not aware of, and I would defer to the request of Senator Reardon, and she may know something that I'm not aware of. And, and knowing her and knowing the number of bills the Senate is dealing with and the time involved, maybe there's a genuine reason for wanting the extension, so I just let it go at that.
Right. Thank you.
Yeah.
Any other questions? And just to comment on that, I think, we're having a big renovation here, and I was thinking maybe the extension, I don't know if we're gonna have a place to do this. So we may be looking at doing a lot of that kind of stuff over the next year and a half or so. Are there any other questions? Thank you very much.
Thank you, Mr. Chairman, and thank you, committee.
Anyone else that'd like to speak on Senate Bill 257? With that, I'm gonna close the hearing. Yeah, we can do, are we on? We can do that right now.
Motion to move into exec.
Got a motion to move into second. I got a second. All those in favor say aye.
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 Move out to pass on SB.
So we got a motion by Senator Avard and a second by Senator Birdsall on Senate Bill 257.
The only question I have, because I'm supportive of this, is didn't we just pass, I think in finance, we also passed it that, although it's not just nursing homes, it's healthcare facilities, that if a patient is going into Medicaid, then the facilities will be able to get paid in advance.
Yes.
Does this help that at all?
I think it's my opinion, because that's my bill.
Oh, yeah.
Yeah. That's this would work in conjunct. I mean, that's a more immediate, this is more of a long-term looking at. That's how I look at this. Being SSI 209B moving to 1634, that's what this is going to study.
So that's a short-term fix.
But in the meantime, the revolving fund that we set up that's in finance will be it works on the same problem, but a different approach to the problem. Yes.
Okay.
I move SB Amendment 0306S.
Second.
So we got a motion. Any discussion on the amendment? All those in favor say aye.
Aye.
Opposed?
I move out to pass as amended.
Second.
I got a motion and a second. All those in favor ought to pass as amendment on Senate Bill 257.
Aye.
Aye.
Opposed?
Consent.
All right, we got a
Senator Long
motion
is
for
on this,
consent. Senator Long is on
I'll take it
this. So let's move consent. Let's vote on consent. So we've got a second on consent. Senator Avard made the motion to consent. Senator Birdsall seconded that. All those in favor say aye.
Aye.
Senator Long, have you take that out? All right, motion move out of executive.
So moved.
Do I have a second? I'll second that. All those in favor say aye.
Aye.
Aye. All right.
Okay.
All right. Are we on time? 9:30. 9:30. The prime sponsor is not here. Yeah, do you want to introduce that, or do we want, you're on the bill.
I am.
You want to do that? Sure. Can we do that? Why don't we just, he is on his way? Okay, all right. All right, well, we'll hang out for just a minute. So, okay. We'll get started. Sorry to hold you up. That's all right. I can relate. One of those days. There it is. So I'm going to open the hearing on Senate Bill 138 relative to record requests by healthcare providers. We have the prime sponsor, Senator McHugh, for us.
Thank you, Mr. Chairman. Good morning, members of the committee. I'm Senator Tim McHugh, District 11, Merrimack, Amherst, Milford, and Wilton. Here to introduce briefly Senate Bill 138, and I'll pass to some of the experts behind me. Senate Bill 138 is a little bit of common sense legislation that has to do with medical records requests. We've all been in government long enough to know that efficiency is everything, and timing and healthcare is super important and sometimes deadly when it comes to getting information to our healthcare providers. So this bill fixes a fairly glaring problem related to unnecessary roadblocks that can sometimes keep medical providers from getting information they need to treat their patients. So right now, New Hampshire law gives medical record holders up to 30 days to release records, even when another healthcare provider requests them. So in the real world, that's not only inconvenient, it can sometimes be a bit dangerous. So this law aims to fix some of that. We think we can do better. Other states already have. Texas requires healthcare providers to furnish records in 15 days. Arizona, 14 days. Even in Montana, with those massive, vast rural areas, they mandate a 10-day turnaround. So in my opinion, in the opinion of some of my colleagues, New Hampshire shouldn't be lagging behind in the 30-day realm. So you might hear arguments, well, it could create a burden on medical offices, but in reality, most records these days are digital. So I think we can do a little better than 30 days. Even in Indiana, they passed a 10-day deadline. So we've already taken some steps to protect records from delays. Last session, we passed legislation capping excessive fees on medical records, and this bill is kind of the natural next step in terms of expediting the provision of those records. So I'll let some of the experts behind me talk to you about some of the specific problems that they've experienced. I think it's a fairly straightforward fix. Brings us a little closer to the 21st century and avoiding the snail mail, 30 days, big envelopes that you have to go pick up and bring with you. Probably all of you have experienced an MRI or X-ray that you had to hand carry, and some of us still do that just to be sure that we have the images with us. So I would appreciate a finding of ought to pass on 138, and I'm happy to take any questions, but I know there are some very qualified folks behind me that can answer on this as well.
Very good. Are there any questions of the committee? No, thank you very much.
Okay, thanks.
Malcolm Perry.
Chairman, members of the committee, thank you very much. Thank you, Senator McHugh. I don't have any written testimony. My intention coming here today was to give you personal experience from the practice that I run. I'm currently the Chief Executive Officer for Darien Medical Center. We care for over 100,000 patients in the southern part of the state. I've been in primary care on administrative capacity for about 20 years. And this issue regarding medical records is something very important to our providers. Very often, patients do have to pay fees to get their medical records transferred to another provider. And I think that is wrong. We all recognize that patients' medical records are really the property of the patient. Ever since electronic records became the norm, the cost that you'll hear from people that may oppose this bill has to be passed on. Well, the cost is really just hitting the print button. So I don't think there's really a lot of cost to that anymore. And it's very unfortunate because sometimes patients change providers' primary care, not for reasons that are very legitimate. The provider's retiring, moving to Florida, or what have you. I'll leave this with you. This happens all too often, and it's actually the norm and not the exception. Consider for a minute an elderly female patient that's had the same primary care physician for 40 years, despite the physician's office being 30 miles away from where she lives. Her primary care physician informs her at her last visit that he's going to retire and move to Florida. In searching for a new primary care provider, the patient locates one closer to where she lives because she finds that driving long distances is becoming more difficult for her. However, the new primary care physician is not part of the same health system as her previous one. The patient requests a copy of her records, signs an authorization for release, to send to the new physician office, ensuring that the new physician has all of her medical history, allergies, medications, etc., necessary to care for her on her very first visit. You can only imagine that staying with the same primary care physician for 40 years, getting regular checkups, follow-up visits, post-hospital discharge visits, and many, many referrals to specialists over the years would generate a substantial volume of medical information. The new physician's office calls the patient a few days before her first appointment to inform her that they have not received a copy of her records from her previous physician's office because she needs to pay them a fee before they will release them. On a fixed income, the patient has to pay $74 for a copy of her records that she had always assumed to be her property. This is not the exception, folks. It's not. It's a reality. I just, as evidence, and I'm not going to name names here, but this is on a website of a hospital in New Hampshire, and I have nothing against my hospital friends, but it does say in their medical record release, you will only be charged if you request records to be transferred to another doctor outside of our health system, or you request records for personal use. So the statute doesn't address this. The Chapter 332, it doesn't distinguish the requester. If the requester is another healthcare provider, there should be no cost to the patient. I leave you with that. But as I mentioned, this scenario, I have seen thousands of times in my 20 years, and I hear it from patients all the time. And so much that we actually started to reimburse patients that transferred into our practice because they had to pay to get their records over to our physicians, and I didn't think that should be a barrier to care. Thank you very much.
Thank you. Other questions?
Just a quick one. What could be the possible reason it would cost more to send records outside a network?
Nothing.
I mean, you don't.
Nope.
That's it. Thank you.
Senator Prentice, do you have a
Thank
question?
you, Senator Rochford. Good morning. Thank you for joining us. I'm just interested in focusing a little bit more on the transfer or the ability to transfer electronic medical records, because, I mean, they're, pressing the print button, that isn't hard, correct? There is a cost of paper, and I know, like, I used to, I was a city councilor, mayor, and we had, 91A requests, and, we had, we would be going through reams and reams of paper. I think we could argue that point all day, and I don't want to. I want patients to have their records, to take them and have them in a timely manner where they need to go. This is what perplexes me, and I'm just interested in your perspective on it. Like, and I have experience with putting a Cerner medical records program in place.
Yeah.
I'm well aware of working with Epic. And why don't these programs all talk to each other? Why isn't there some front end charge in terms of like when hospitals and practices enter into these agreements where they are like, when we get this request, the signature is made, there's the push of the button, because then it ends up there in a timely manner. I'm just interested in your perspective on that, because it frustrates me. We have all of this, all of this in place so that within health systems we can see information, but we can't get it to each other.
Yeah, it's something that with the state of New Hampshire doesn't support a health information exchange, a public health information exchange, with the exception of the vaccination, with the exception of vaccines, the immunization records, and electronic health records. These companies don't like to play together very well. However, there has been movement over the last few years around standards as part of, I believe it was the CARES Act, that put together standards for information exchange. I don't know if you're familiar with TEFCA or Care Quality. These type of softwares are giving the ability for disparate health records, electronic records, to communicate electronically. We're getting there, but it's being done in the private sector mostly, unfortunately, and not a mandate sort of from government to force that kind of electronic information transfer. I wish it was. I mean, the whole purpose of electronic medical records, in the past, was to make this sort of seamless for patients, And that goal was never quite achieved. We are still dealing with a lot of transfer of records that, frankly, we're in 2025 and they're still faxing of information. It's pretty crazy.
Thank you for your perspective on that.
You're welcome.
More to come. Yes.
Senator Abard.
Yeah, just for discussion, is AI going to be involved with any of this stuff in the very near future? Because I foresee, I think that's going to be an issue that we'll probably have to deal with.
In what respect?
Well, you call up your provider and there's an AI answering the phone.
A bot.
A bot,
Is it a
yeah.
Yeah.
And then we have I don't know, it's just on my mind lately.
Yeah.
I don't know how that's going to affect what we do.
I think AI is going to be very important in the future to make things more efficient. If I told you that a typical primary care provider who sees 18 patients a day and works 4 days a week, probably spends another 12 to 15 hours documentation a week. That's where you're going to see the efficiency come in, because the AI technology makes that documentation task a lot easier, as well as responding to patient messages. It used to be that a primary care doctor could see 24, 25 patients in a day, because when there was paper records, because there wasn't all these buttons to push and all this documentation, and certainly that has all kind of slowed down because you can't get through the electronic record the same way that you would just document a quick note. But I do think AI is going to have an impact to make things more efficient, so that doctors are people too. They need some life work balance. And they, especially in primary care, we are, there's 6,000 referrals that we send out every day. They got to review all those reports coming back. There's at least probably 12 to 15,000 referral requests every month. The amount of time that providers spend outside of the exam room is extraordinary. And I think AI will help with that.
Thank you.
Any other questions? Senator Long.
Thank you, Mr. Chairman. I think you may have answered this in your testimony, but as far as digital, are you saying with Derry Medical Center, it's 100% digital transfer?
Yes.
Okay, and are there times when an employee has to put some documents in once it's requested?
Yes.
Okay.
Yes. Oftentimes we get paper copies, and then our staff have to, index what they call index them, and then file them to chart, and that takes a lot of time. But even if we got them, when you say electronically, you're not really talking about a transfer of electronic information from one system into the new system. What you mean by getting them electronically, you get a flash drive. You still have to put that in the computer, print off the paper, and then indexing. The systems don't really take charts from one system and automatically populate, your EMR. It doesn't work that way, unfortunately.
Thanks.
Any other questions? Thank you very much.
Thank you very much.
Marissa Chase.
Good morning,
Good morning.
Mr. Chairman and members of the committee. Thank you for the opportunity to testify. For the record, my name is Marissa Chase. I represent the civil plaintiffs' lawyers. So our organization doesn't have a position on Senate Bill 138 as is. I think it's personally probably a good idea. And I want to thank Senator Birdsell and the majority of this committee is the same as last year for engaging with us on Senate Bill 65 to cap the fees of medical records that was referenced earlier. And I agree with pretty much everything the previous speaker said. What I wanted to talk about today was this issue of the costs and fees of medical records. And I talked to the sponsor, and I hope I'm not speaking out of turn, but I think it might be a good idea to have some kind of commission that sunsets to take a look at all of these aspects of medical records. A lot of the questions that Senator Prentice was talking about and that Senator Avard said, and it looks like you guys are agreeing. And Senator Avard, I can tell you AI is being used in medical records today. Our members have plenty of horror stories. I have plenty of examples compiled of patients still being charged exorbitant fees to access their own records. There are many third-party companies that contract with healthcare providers, not everyone, there are a number of them. And everything kind of goes across the board. You see entities like some of the largest healthcare facilities in our state furnish complete records for free to the patient or their authorized representative upon request. And then you have some, entities that contract with entities like Datavant, Sharecare, Ciox, et cetera. I'm not trying to disparage any one of them, but just as an example, will not give a free, it's like pulling teeth to get a free, not free, to get a complete medical record that can cost hundreds and thousands of dollars. Some of you who were on the committee last year will remember some of those examples, and I think we were all horrified by that. So would love to kind of keep an eye on all of these issues with a group of stakeholders continuously, because this is an evolving field. Ms. Senator Avard said it's only going to probably get more complicated.
Thank you. Any questions? Senator Bertzel.
So we have to exec this out today, I believe. Do you have any language that we can use to attach as an amendment?
Sure, I can put that together today, this morning.
Okay.
Like, yeah.
Sure.
Any other questions? Follow up?
We can also do a floor amendment if we have to.
That'd be easy.
Whatever the committee wants, I'll make it work.
Very good. Anything else? Very good. Anyone else like to speak on
Thank you.
Senate Bill? Thank you. On 138. With that, I'm going to close the hearing.
Motion to move into exec.
All those in favor say aye.
Aye. Motion to author pass SB 138 to pen.
Any further discussion?
Yes.
Yes.
Did we want to wait for an amendment today or a floor amendment? Floor amendment?
Yeah,
All
I
right,
think
'cause
that would probably be cleaner. Then it gives us a week to kind of make sure all the members, because if we're talking to commission, it's going to be
we need to make sure we get the right stakeholders.
Yeah.
I mean, I think we're going to continue to have these conversations, and with the emerging technologies, the Senator Avard brought up AI. I have this concern about systems that don't speak to each other. And balancing, patients should have their records, but we've got all different size practices and all different size hospitals. Got to figure this out. And, I think we're moving in the right direction, but embracing an ongoing commission to address this, I think, would be beautiful. Thank you. And I don't say beautiful that much, except about my talk. Thanks.
Any further discussion on Senate Bill 138? Call the question. All those in favor say aye.
Aye.
Opposed?
Consent?
Do we want to put it on consent if we're going to have a floor amendment?
Oh, that's right, we can't.
We do not want to put that on consent, so I'm voting no.
Okay.
All right. So
We
withdraw the motion, withdraw the second, and Senator Birdsall, you're on this. Would you like to take this out?
Yes.
All right. That was 138.
So I move ought to pass on SB 288.
Wait a minute.
Hold on a minute.
We should have a yoga class at the beginning of every exec session.
No, thank you.
Where's my list? Come on, now, I'm.
After.
I know somebody who does yoga.
I do too.
Hot yoga.
A Bikram. Where is my list of things to be exec? It was here.
She had an amendment.
Hold on.
Do you need this?
I'm being behaved, I promise. I know Marie's looking.
What number are we on now?
I got it. Okay.
What number are we on now?
What?
What number are we on?
I don't know. That's what, so there is a list.
288.
Yeah, I got it.
Okay. 288.
That was supposed to.
Oh,
be some kind
instead of bill 288 on, are we waiting for an amendment on that too?
We don't have the amendment, and I'm told we probably won't have it
It'd have to be a floor
today, so it had to be a floor amendment.
In principle, I like the bill, and I know that there is an amendment coming. In order for it to come,
I don't even have 288.
That was the first one.
Oh,
it was the
yeah.
first bill. In
Sorry.
order for it to come, the amendment to come, we have to pass the bill.
So do we want to pass the bill? I know there was some question whether adding the New Hampshire Brain Injury Association, we want to add that today? Or
As
do
a
we
floor
want-
amendment, sure.
or as a committee amendment,
Committee amendment.
and then we do the floor amendment afterwards?
So moved.
Okay,
Well, why don't we just do one full amendment and,
to make sure the floor amendment has the New Hampshire Brain Injury
Yeah.
Association. Okay,
So-
I'm fine with that.
Unmoved.
All right. So I've got a motion, OTP 288 from Senator Avard.
second?
Senator Birdsell seconds that. Any further discussion on 288?
Senator Rochford, so.
Yes.
I plan to support 288. I do, I appreciate what the representative from from Craig DeBar from, I'm gonna mispronounce his last name. So the representative from the municipal and county, leadership came and talked to us about a concern. I spoke to him out in the hall a little bit. I think that a seat at the table, they're already on the legislation. I can see a concern about duplicating efforts, but this is it's a larger problem, and they've got that seat and can bring those efforts. That's why we have these, in my opinion, these commissions, is that you're bringing that perspective and that work to the table. So I don't think sympathetic's the right word. I understand his point, but I don't want to hold back on moving this forward. I might not have worked on these specific bills, but Senator Carson and I, over the last few years, have tried to do work to move, find ways to move patients that don't belong, like the person 692 days in a hospital, out. And instead of one package, we're looking at multiple approaches. And this was one of the ones that was agreed upon. So I was in touch with the gentleman, and I am understanding of the county's perspective, but I still want to move on this and keep them right at the table with their voice. Thank you. Just wanted to get that out there.
Thank you.
All right.
Any further discussion on 288? Call the question. All those in favor of ought to pass on 288, say aye.
All right.
Any opposition? So I think we're not going to put this on consent as well because we've got a floor amendment coming.
No consent.
All right. Senator, who do we have on this one? You're on this one as well, Senator Birdsell. Do you want to take this one out, or do you want? I can do it. All right. Senator Birdsell has been volunteered to take that one out.
It's gonna be a busy week for me next week.
Well,
I
I can
got a lot
do it.
of
I can
finance,
do it. I don't have a problem doing that. All right. Five to nothing to pass.
And needs a
And we
floor
have
amendment.
floor amendment, therefore we can't put it on. consent.
Right.
Correct.
And Ruth is going to bring that.
So that's all the bills that we just did today. So let's move on to our other bills here. Do an easy one here.
Can we go back a little bit?
Yep.
I do have a letter from the Association of Counties on 288, sorry, on 288. Did they speak at all?
Yes, and that's what Senator Prentice was referring to. Yeah.
Okay. I'm sorry, what were you saying?
So the concern that I heard was about the work that they're already doing, that
Yeah.
this will, duplicate efforts and potentially take away from some of their work. And I can understand that, but at the same time, I feel like that's why they have a seat already at the table.
Okay, got it.
And so I encourage the robust participation. So that's what I think.
And we can't bring the amendment unless we pass the bill,
Okay.
which we did.
All right. Senate Bill 254. I'm going to move on to pass on Senate Bill 254.
That happened to be yours?
That happened to be mine.
It
Yeah.
happens to be, yeah.
It's an easy one.
Not financial, so that's good.
No,
And there needs to be an amendment?
no, there's not need to be amendment.
Yeah.
Second.
Yeah, the third. Right here? It was,
That's actually, that's the bill.
Right.
So this just takes that out. And the bill, that's all this bill does, is takes that, those 4 words out. Simple.
Third.
Easy peasy.
Gotcha.
Yep. So if you recall, this is the one that the legislature changed federal or controlled substance inventories a few years ago and left in 4 words every odd number year, which is not consistent with federal law, and that's all this one does. So makes it consistent with the federal law.
Oh, I'm looking at 252. Jeez, Louise.
That's why you couldn't find it.
Yeah. 254.
Got it. All right.
And it just breaks on line 6. Yeah.
Yep. Technical change. Correct.
Already been moved and seconded.
Been moved and seconded. Any further discussion? All those in favor say aye.
Aye.
Opposed? No opposed. I move consent.
Second.
Consent. All those in favor say aye.
Aye.
And I'll take that out. All right.
Whitney is the Rock.
Rock.
What? That's his nickname.
The Rock?
His name means
En français.
in France.
France?
In français. Rock. Yeah.
Never done.
It's your tattoo, man.
I don't have a tattoo. All right.
Okay.
Next one up is another one of mine, Senate Bill 247. And there's an amendment.
Sophie sent it to us.
She did, yes.
Ah, so you're exempting Medicaid and Medicaid
Well, that's this.
care management.
Yes. Well, there's actually 2 amendments. I'll speak to them. They're not hard.
Looks
It
hard.
goes.
I'm going to move ought to pass on Senate Bill 247.
Second.
Yes, I'll take them. All right. So Senate Bill 247, motion ought to pass. There's 2 amendments. The first amendment that I want to speak to is the one that just came over yesterday. And if you recall, the Department of Insurance was here and they talked about putting the bill in different sections of law. So there shouldn't be any changes in the text, but it just puts it in 2 different sections.
So you want to move amendment 1077S?
Yes, so I'm going to move Amendment 1077S.
Second.
Any discussion on that or questions? All those in favor on 1077S, we take that vote now because we've got another
Yep.
amendment. Say aye.
Aye.
Opposed? All right. And the second amendment I'm going to move Senate Amendment 2025-0857S.
Third.
And then we've got a second from Senator Birdsall. And that's all this does is clarify that nothing in this section shall be construed to apply for Medicaid or Medicaid care management plans. That gets us out of any problems we may have with federal Medicaid laws. Did you have a question? Oh, okay, all right. So any questions on Amendment 0857S? All those in favor say aye.
Aye.
Opposed?
Move on to pass as amended?
So we got a motion and a second. All those in favor say aye.
Aye.
Opposed? Move consent.
Second.
All those in favor say aye.
Aye.
And I will take that one out. Oh, is anyone opposed? Yeah. I heard it. I got a good ear. I shouldn't say that. I don't have a good ear.
Jim Gray got dinged for that in finance yesterday.
Oh.
Really?
Yeah, because Senator,
Rosenwald?
yeah, Senator Rosenwald.
She dots all the i's and crosses all the
I know
t's,
she does.
and I like that actually.
It's 247. Let's go on to.
Ooh, this paper.
247.
That was just, we just voted on that one.
Yeah. Okay, I thought you said we're
All right.
doing.
Nope. 248,
I got written hold for some reason.
establishing a committee to study palliative care, palliative and hospice care in New Hampshire. That's your bill.
Second?
So we got a motion, ought to pass, a second. Any further discussion?
Was there, I know there was, was there an amendment coming forward to add
No.
a couple of, no?
No, we,
Granite State Home Care wanted to be included, I guess.
Case management had different views on what is. to discuss.
we can't add anyone to it because it's a
Oh, it's a
study
committee.
committee versus a commission.
Yeah, okay, good.
Any further discussion on Senate Bill
Sir.
248?
Yeah, but certainly we can't add anybody, but people can come.
Right.
Yep.
And I've seen study committee chairs be very specific about who they invite to make sure that all
Right.
the topics are covered.
And you don't hit rabbit holes and find yourself.
I suspect I know who the Senate's gonna be on this.
It's your name.
I know. Thanks very much.
Don't look at me.
Come on there, I'd be interested.
Okay.
So-
Likes the idea.
I'd be interested.
We've got a motion and a second. Any further discussion on Senate Bill 248 as the bill is before us? All those in favor say aye.
Aye.
Any opposed?
Consent?
Second.
Motion for consent and a second. Good, Sophie? All right, all those in favor say aye.
Aye.
Opposed? Senator Birdsall, that's your bill.
Yep.
I'll have you take that out.
Okay.
Moving right along. Oh, wait a second. That one was 248.
Oh,
I'm just making sure my notes are.
You got an amendment for this one?
Yep. I do. One more.
Thank you. You gonna motion?
All right, so
Yes.
Senate Bill 252. I have a motion.
move on to pass.
I'll second that. So we have a motion ought to pass. Senator Birdsall, I seconded that. Senator Prentice.
We need a committee amendment. So first of all, it's actually Chair Rochford, I'd like to discuss and then introduce a committee amendment. So here's the good news. After this hearing, everybody got together pretty quickly between the physician's assistants and the nurse practitioners to get the language right so that those with prescribing authority were all included. The one thing that I had asked to be eliminated or, struck from the bill had to do with, and we're going to go to page 2, because now it's page 2, section line 6, item 4, physicians and surgeons telemedicine for spectacle lenses or contact lenses. Just to go back to my original testimony, I knew it was a problem that day because if we're talking, there has to be physical exam capability in establishing that relationship with those that provide eye care has to be done in person. And so but in the translation and working on the amendment, somehow between Friday and Monday, and I know there was some downtime with Wi-Fi yesterday, this got missed. So I would like to, as I originally stated the first day, take that out. The rest of this, the additions are about clarifying the physician's assistant's role in this, because they are prescribers, and the nurse practitioners. So, and those organizations got together, worked on the language, and then brought it to me.
Should we change it to physicians associates?
Not until the law changes.
Yeah, let's wait.
Yeah.
No,
Sorry, it's not Michael, sorry.
No, I don't want to get ahead of myself.
I think Senator Birdsall has something to say.
Yes.
Why don't we take the amendment and then accept the amendment and then do a committee amendment to strike it out?
Yes, okay.
All right, so you're gonna move the amendment.
I'm gonna move amendment 1107S.
I'll second.
Discussion.
So,
We already just.
we're discussing that now, and we're going to adopt that, and then we'll do a second committee amendment to fix that.
To so the committee amendment would be
They cross out or, or leave in the in-person care.
they have
the
to
spectacles. Yep.
that the section starting on line 6, item 4, that need everything but the effective date, which is at 12. So 6 through 11 needs to come out. Yeah.
Okay, so let's vote on the amendment, and then we'll
Okay.
do the, so all those in favor of amendment 1107S, say aye.
Aye.
All those opposed? Okay, so Senator Prentice, your committee amendment,
What you just said.
what you just said,
Eliminate line 6 through 11, page 2, item 4, physicians and surgeons, telemedicine for spectacle lenses or contact lenses. So we're not going to amend that part of the RSA.
Correct.
That would not work. That does not comport with,
Yep.
you know, the operations of this type of bill.
And keep line 12?
Line 12 is the effective date, so yes.
so Sophie, just to be clear, the amendment we just adopted strikes out in person, the committee amendment is to put that back, to.
I heard just the opposite.
Just to make sure I understand.
Okay.
I understood as we adopted this whole thing,
Yep.
and then we're adopting a committee amendment that just strikes out
Strikes out all of it, yes.
line 6 through 11 on page 2.
Okay, all right, yeah, that's easier to do that. That's easier, yeah, yep, that's
Second.
easier to do that. All right, any other questions on that? Yep,
Senator Prentice made the motion, I seconded.
all set? All those in favor of the committee amendment, say aye.
Aye.
Opposed?
I just always raise my hand.
Move on to pass as amended.
Yeah, we're gonna do that first. Motion ought to pass as amended. And Senator Birdsall seconds that. All those in favor say aye.
Aye.
Opposed? Okay, do we want this as consent? I don't,
Oh, I'm for it. I raised my hand instead of saying aye. Yeah.
yeah, okay.
I was for that.
All
It's
right.
an old habit.
Senator Prentice moves consent.
Second.
Senator Birdsall seconds that. All those in favor say aye.
Aye.
Opposed? And Senator Prentice, I'm sure you'll want to take this out.
Yes. I'd be happy to, thank you.
Yes.
Yes. Thank you, Sophie. Slow down the train.
Yeah, I have everything. I don't have anything open.
Motion to move out of exec.
Second, all those in favor say aye.
Aye.
Opposed? All right, so we're out of exec session. Okay.
Are we allowed to adjourn now? Do we need to adjourn? Do we need to? Okay.
All right.
Sure, we
We
just
have
don't
to
want
ask
to
the
wait.
boss here.
Wait a few minutes. So it's 10:26. Let's wait till 10:30.
All right.
Just in case.
We'll do that.
For why?
Just to breathe.
This
Sebastana. What do you call it? Is it Sebastana?
I don't even know what. I just wanna.
All right.
I never. Yeah.
Really do the call of the chair.
All
What do
right,
you-
ready.
If you're ready, you
So with that, we've concluded all of the Senate bills for this year, and I am going to adjourn.
Oh,
Hey.